SmarTrack and Dashboard simply help you in that process by facilitating the display of your data so that at a glance you can see immediately in your organisation what the anticipated start time was, what the actual start time was. You can easily see the delay and then you can address it. And I think from a theatre management point of view, that's an extremely powerful tool. I think it takes some getting used to. I think it takes a change of practice. Theatre management has traditionally always been done retrospectively, and now you're asking them to move into a more real-time environment, to interact with the staff on a more real-time basis, and it's a difference in the way that they work, and that has to be addressed. But I think it's a very simple, straightforward tool. It's got a very simple, they've both got very simple graphical interfaces. It's very straightforward to see the information that you require, and it's very hard for clinical staff to challenge that data because it's data that they've entered into the system, which is now displayed, and that they only entered maybe an hour or a few hours ago. They can remember exactly what happened. They know what the issue was. It's much harder for them to pick holes in your data, and that makes it easier to progress your system forward, because otherwise the clinicians will always put hurdles in your way. They'll refuse to believe you, and you just don't go anywhere. You go round and round in a circle arguing with each other, and that gets you nowhere. So I think that's where SmarTrack and Dashboard are so powerful, in that it's just a very simple, clear display of data that's been recently entered by the team themselves, and you can't argue with it. It's very difficult to argue with.